Thanks so much. First of all, I just want to say welcome to everybody who's on this call. It's really awesome. Nursing homes and ageism. Does anyone care? That is really a big question, and it's fundamental to what we've seen through the pandemic, and it reflects backwards to all long-term care and particularly nursing homes, because we don't really think about, they're just an invisible population for lots of reasons, but they are invisible. And the pandemic has exposed the horrors of long-term care systems, particularly nursing homes, and has exposed the issues of the individuals in there. Grey Panthers NYC, as all of you know, has been around for decades. And what we did for the pandemic, we've done a lot of stuff, but more specifically, we did our documentary Honoring Nursing Home Lives Lost, which many of you have seen. And that was an examination of the visceral pain that experienced by nursing home residents, nursing home staff, and families, as an example of how this is affecting the depth of the psyche of everyone. And subsequent to that, Michelle Arnaud, who is our vice president, suggested that we start this series. We call them Transformation Tuesdays, which look at underaddressed issues on nursing home transformation, because this is our opportunity to actually change something. It's hard going. It's very difficult and troublesome. One of the underlying issues to this that all of us see is ageism, and how that manifests itself in the nursing home and long-term care, but particularly in nursing homes. We are so excited to have an amazing panel that is compassionate and knowledgeable and powerful, and we're just lucky to have them. This will go for 1 hour. And if you have questions, please put them in the chat. I know that everybody is passionate here, and let us see how we can change that passion and the words, the spoken word, into action. We're going to be looking at ageism from a number of different perspectives, and the run of show is going to be Margaret Gullette, then Beth Finkel, then Lori Porter. I know that all of you are going to be like blown away, and we're going to start because there's a lot of people who want to say that there's a lot of things that need to be said. So I'm going to do short introductions ahead of time so that we can save time during the presentations. The first, of course, is Margaret. Margaret is the author of prize-winning Ending Ageism, or How Not to Shoot Old People, and 4 other books on age and ageism, including Aged by Culture. The concept that we are aged by culture has been liberating. New Yorker has called it iconic. She's also working on this book called American Eldercide, and she has been passionate and powerful on looking at ageism and long-term care through COVID. So that we are honored that she's going to be working for us. Then, of course, we have Beth Finkel. Many people on this call will know Beth. She is one of the anchors of advocacy for older people in New York as the state director of the AARP in New York. And Beth, I don't know how you do it, but literally you are everywhere. Everyone knows you. My eyes are not what they used to be. So Beth leads the day-to-day operations of AARP in New York, which obviously all of us know that. know AARP, the most visible and successful organization in the state advocating on behalf of New York's 50+ population. You know, Beth has had her hand in just about everything regarding older people in New York. She leads many of the lobbying efforts in New York, and there are, as she properly notes in her bio, 2.5 million New Yorkers and their families have led to historic New York State reforms, and there are just a whole list of them. One of the new things that, with regard to this webinar, is the success that AARP has been having with regard to advocating on behalf of nursing home and long-term care reform in the state of New York. So much of what she's talking about it from a perspective of actually having worked with the legislature on this. So her concerns are going to be quite insightful. Then, you know, we have Lori Porter. Lori is the co-founder and chief executive officer of the National Association of Home Care Assistants. Now, many of you know that in nursing homes, the people who actually provide the care are the certified nursing assistants. And their situation has never been on the public's radar. And Lori has a unique perspective on looking at it from the inside. So she's going to be able to tell us, with the passion that she always brings, about ageism in nursing home. She brings more than 40 years of skilled experience to the leadership of the association. Lori was a certified nursing assistant for 7 years, admissions director for 2 years, a nursing home administrator for 7 years, and at the helm of the association since 1995. She is dedicated to motivating, educating, and developing frontline excellence. She's a motivational speaker whose dedication to long-term care is evident in every speech and every communication. You know, and I've had the pleasure of working with Lori in this new coalition called the Live Oak Coalition, which is dedicated to overhauling the long-term care system. So what I'd like to do is I'd like to start. Margaret, would you be able to make your comments and presentation?
Yep. Thank you, Jack. And what an honor it is to be on today with these people. I know them from their reputations. Now I'm about to hear them. Let me say this: everyone on this webinar cares, and thank you for being here. People don't know how evil ageism is until they accept the fact that it brought down to untimely death at least 112,000 people living in nursing and veterans homes in only the first year of the COVID era, much more now. They were abandoned by the government that is statutorily and ethically, of course, responsible for their well-being and their lives. Ageism explains why. If we understand that ageism in this case is compounded by ableism, or fear of dependency and physical oddity, by sexism, classism, and fear of Alzheimer's, this compound led to what I call, and ask you to call, the elder side. In early 2020, the response of then President Donald Trump to the pandemic was reluctant, belated, and murderously inadequate. For understanding what happened in the Oval Office and elsewhere in government, the first crucial time frame ran from the date of the first known US deaths in late February and lasted through at least mid-March, when timing was crucially important. Everyone knew that the virus was felling only people living in nursing homes in clusters. In the first panic, the media focused the whole country on the fatalities in a nursing facility in Kirkland, Washington. As early as March 18th, 2020, the Seattle Times, focusing on those older adults, treated them as a data point. About a fourth of the coronavirus fatalities in the US have been linked to nursing homes. The disease is especially dangerous for the elderly. That journalistic leap in language from nursing home residents to, quote, the elderly, swept all older community dwellers into one high-risk category. And this too was to have fateful consequences. Soon, it was the residents alone who constituted 40% of the US dead, wildly disproportionate to their minuscule share of the US population, under 1%. The death toll was staggering, but the deaths did not seem as surprising as they should have. The mortality rate only confirmed a dehumanizing stereotype that had long rendered them expendable, waiting to die. Aversion exists at the intolerant and the intolerable end of a range of emotions toward lesser others, heightened in the wholly new, out of control COVID era by the danger of being old or frail. For Trump, a taut, distasteful chain uniting age, dementia, disability, residence, and expendability was already top of mind. Only months later, running against Joe Biden in that election year, Trump told Fox News, he's mentally gone. Biden was a few years older, but Biden was Trump's opposite in obvious physical ways. Boyish, where Trump was portly, known for bike riding while Trump used a cart, getting around the golf course. Trump was notoriously squeamish about physical disability. On the campaign trail, flapping his arms and hands manically in the air, he mocked a reporter. Not unexpectedly, Trump tweeted a photoshopped image of his Democratic rival in a wheelchair, seated among elderly people in what appeared to be a nursing home, captioned it, Biden for Resident. Although Trump was obese, male, and age 74, he identified immeasurably with youth, wealth, the color gold, social clubs, rich donors, fastidious cleanliness, and exclusivity. To such a man, the residents, now uniquely associated with death, were needy, dependent old people slumped in wheelchairs speechlessly or being wheeled out on gurneys. Psychically, the aging, preening narcissist had to dissociate himself from them. He believed, as so many Americans still do, in the inexorability of that death toll in the nursing homes. Doomed to die can't be helped. There's a touch of superstition in this aversion, as if one type of ageism, warding off one's own personal decline, demanded another type of ageism, hating or shunning old people. Combining the two, shunning other old people while denying one's own aging, can be toxic. So Trump's first policy, quote, decision was to do nothing to rescue those living in the very locus of the plague. He abandoned them, unleashing the elder side. And we know that he was getting coronavirus news in his daily briefing. Personal protective equipment from the national stockpile was urgently needed to save the lives of aides as well as residents and keep the hospitals from overflowing. But the government first denied PPE to the nursing homes. Even after known outbreaks and public calls to use the Defense Production Act to produce PPE, Trump did nothing. It wasn't until April 30th, 2020, that he formed a special commission on nursing home safety, calling nursing homes a little bit of a weak spot. When the quality and safety report came out a full 4 months later, September, it merely urged those facilities to do right. Enforcement mechanisms, the teeth in any reform, were not added. In fact, they were pulled. The private nursing home industry lobby, which had long degraded quality of care standards, almost immediately got 20 states to waive liability suits for the industry. The Trump failures to protect are often attributed to incompetence, avoidance of science, Republican fear of disrupting the economy, losing the 2020 presidential election. But ageism and ableism, which have fantastic unconscious motives, as well as rational and cynical ones, explain the failures better. Ask yourself if the disease might have gotten a proper government response instantly if the first victims had been children instead of people on Medicare and Medicaid in nursing homes. Preventive measures would have been taken as widely as they were in the polio epidemic of the 1950s. By the fall of 2020, it was obvious that the virus had jumped the confines of nursing facilities and was about to reach a toll across the population, then only 200,000. At that moment, at a rally, Trump offered the opinion that the coronavirus only, quote, only affects elderly people with heart problems and other problems, but it affects virtually nobody. It's an amazing thing. An English professor who quoted him wasn't comforted. Notice the quick segue between elderly people and virtually nobody. Virtually nobody. Other parts of government also treated the nursing homes as if they housed virtually nobody. If those 1.4 million nobodies had been kept safe, it would have kept the hospitals from being overrun. Lockdowns were supposed to help, but the facilities were deprived of PPE, testing, staff capacity, or other infrastructure support, such as alternative bed capacity for cohorting patients and residents. Medical science, public health concern, mere common sense should have reigned. Instead, the government focused on the needs of hospitals. Elaine Ryan, the plain-speaking vice president of government affairs at AARP, suggests that this was disastrously wrong-headed. Early on, she says, there was a lack of prioritization for nursing homes. Hospitals were seen as the epicenter of the crisis, but the epicenter of deaths was in nursing homes. That's Elaine Ryan. A Brandeis University dissertation reports about Massachusetts, as in many other states, quote, the Baker administration prioritized hospitals by helping them to secure resources, even though they were in a better position to bid for PPE than nursing facilities, and by holding meetings with hospital heads to which nursing home leadership was not invited. 3 geriatricians concluded our cultural fear and societal revulsion around aging have simply rendered invisible, as Jack said, the patient and resident population and the workforce that helps those who need post-acute and long-term care. Doctors can be ageist too. I'm sorry to say that we were treating them, so many of them were treated and rightly as heroes, but ignorance of geriatric medicine and of disability rulings had permeated the medical profession long before COVID. Not teaching geriatrics, a form of ageist disregard, had long characterized most medical schools, even as longevity grew and experts proved that geriatricians would be in high demand. Not enough medical students chose the field. Many doctors-to-be considered treating old people too hard. Multi-morbidity buffaloed them. Even before COVID, young doctors felt despair about the futility of treatment, and that comes from surveys. Gomers, a name many medical students had learned for old people during their residencies, means get them out of my emergency room. Medical ageism had typically occurred in secret, one-on-one, if your doctor ignored your treatable condition as mere inevitable aging, a beginner's mistake. But the nursing home catastrophe brought old people into contact with doctors, not one by one, but in battalions. With alleged age discrimination in Italy as a backdrop, various US medical centers, state health commissions, and bioethicists rushed to suggest triage guidelines for US hospitals. Now, medical triage means that some people coming into hospitals or elsewhere receive lesser or no access to treatment. So early in any crisis, setting the proper criteria for treatment is crucial for saving time and for avoiding injustice and guilt and tragedy. Now, it was April 2020, ICU ventilators first appeared grievously necessary and scarce in New York City and Boston. So rapidly, the process of deselecting some patients was defended as crisis standards of care, a euphemistic, an enigmatic euphemism. Since the US does not have a national health service, which must stand by since the US does not have a national health service, which must stand by one universal ethical standard, such as the UK has or France, the triage guidelines are the only semi-official codes the US had or has. So I decided to read the main triage guidelines, and they make dismaying reading. Access to the ventilators turned out to be a proxy measure for who counts in American society. The University of Pittsburgh guidelines, a model for many states, do not mince words. The tiebreaker should be age. These guidelines give priority to patients within these age groups. Okay, first, 12 to 40. Second, 41 to 60. Next, 61 to 75. Next, last, over 75. Gut-wrenching, the Boston Globe commented on April 7th, 2020. If there were any very sick younger adults, the likeliest outcome would be that no one over 40, forget about those over 75, would get a ventilator. This at a time when they, especially the residents, were most at risk of dying, although many, including the residents, could have been saved. Let me make one last point to bring us up to date. When vaccinations came in 2021, thoughtful Americans, caring Americans could think with relief, okay, now our vulnerable elders are protected. Indeed, residents, unlike some other Americans we could name, rushed to get vaccinated. But their aides and administrators, often refusing, were still bringing disease into the lockdowns. It took Biden a whole year. He delayed until this winter, 2021, 2022, to issue a mandate that all nursing facility employees had to be vaccinated. Why did that take so long? There are many reasons, but one of them is that the residents have become invisible yet again. Who cares? Now, Jack has asked me to add a call for reform because some people believe that a tragedy can be an opportunity for reform. We have to see whether that is actually going to happen. But let me have two suggestions. You can start with monitoring your own state. I know there are people from all over the country on this call. What is your state doing, if anything, to protect the residents of nursing homes? Okay. Second, you may like talking to people. If you like talking to residents, volunteer for your state's ombudsman program. It's quick training, and it also provides valuable oversight, which we did not have during the first year of the pandemic. So can't wait to hear from the others now. Thank you.
Margaret, thank you for that very passionate discussion on what happened and ageism and how this fits into the political spectrum, as well as how it makes mincemeat of all of the people who have been so adversely affected. And that's aside from the residents, families, and staff, it's all of us that have been adversely affected. And we have hundreds of thousands of deaths that we need to honor. So thank you very much, Margaret. And now that we have that kind of passionate discussion, I'd like to turn this over to Beth for, I know it's going to be awesome.
You know, you're supposed to under promise and over deliver. So
You always
now
deliver,
what did
my
you do
dear.
to me, Jack?
You always deliver.
So first of all, I want to say hi to, I see so many people on this call that I have worked with and done advocacy. And if I start calling out your names, I will be sure to leave somebody out and I'll feel terrible. But many of you know who you are. And thank you so much for all of your many years, including you, Jack, of advocacy for older adults. Much appreciated. So I just need to talk about ageism writ large for a second. And Margaret, I think that you looked into a lot of the same reference materials that I did. So forgive me if I'll try not to reiterate what Margaret has already said. She brought some great data to us and really insightful information. So ageism, right? Ageism is just all around us. It's in the viral videos that we see. It's in the commercials that we see. It's always about belittling older people in so many of the commercials, but it's also, as Margaret cited, belittling politicians who are aging, which is really very insightful about how our society really feels about aging. Ads that glamorize youth and even in the way buildings are designed. I know we're supposed to have handicapped access, but it doesn't always feel that way when you have to get places, when you have to go from here to there, particularly New York City subways. Those of you who've tried that anytime recently, it is no fun. So AARP has been working on issues across the board that because we believe that everything in policy really stems from the problem of ageism all the way down. So when you look at housing and not enough affordable housing for older adults, when you look at people being ill prepared in terms of retirement finances, and then what happens when you get there and, you know, things fall out from under you due to no fault of your own, not to mention COVID and the current economy. When you look at trying to get a job when you're over 50 and the percentage of older adults who have experienced, over 20% actually in New York have actually experienced age discrimination in the workplace. And 10% have said that they lost their job directly because of ageism. So really, it stems everything. But I'm going to talk from the New York perspective. Even if you look at the budgets of the New York City Department for the Aging or the New York State Office for the Aging and the percentage that they are of the overall budget for New York City and New York State, they are minuscule, really. I mean, when you look at New York City, almost 30% of the population is older adults, and yet less than 1%. It's actually closer to half of 1% of the New York City budget goes to aging. So that, you know, that is ageism right there. When you look at New York State and you realize that our director of the State Office for the Aging is again a director, not a commissioner, as it is for children and families. So what happens? Aging is not at the grown-up table, folks. Right? Aging is at the side table because it's not a cabinet position. And that's about prioritization. There are more older adults in New York than there are children 15 and up younger. And I want to be clear, I'm not looking at a generational war here, but you have to be able to point this out so that we can make change, because it just isn't acceptable on how things are prioritized. This goes back to so many of Margaret's points that she made before. That's why resources go where they go. That's why decisions are made. And so now let me just look at it from within COVID and from within nursing homes in particular. You know, as Margaret said, there were well over 100,000 deaths in the United States. New York almost led the nation. We did for a little while with over 15,000 deaths in nursing home in New York State. And what was that about? You know, that was about the resources and how they came to get to nursing homes. And we can go back and look at the systemic ageism back through generations. And we can look at what created the current nursing home world that we're living in right now. It really dates back to laws that were created in Social Security and in 1935, which really planted the seeds for what our modern nursing homes look like. Because at that time, the Social Security Act prohibited payments to residents of public institutions. And because of that small kernel, that's what launched the rise of private nursing homes. And the next law that was a major influence on today's nursing homes came in 1954, and that was the Hill-Burton Act, which funded hospital construction and was expanded that year to provide loans and grants to build nursing homes that agreed to provide low-cost care. Okay, and then what happened when we created Medicare and Medicaid in 1965? And the Medicaid at that time, which covered primarily the poor and is funded by matching state and federal funds, that became the payer for long-term care and nursing homes. And today, we know it's well over 80% of the beds are paid by Medicaid. And that's and it's set up like that. And many of us understand that. I know you got some great elder bar attorneys on this call, because I looked across the board who's on, and we know the system was literally jerry-rigged to force people into spending down in order to get Medicaid to pay their long-term care costs, because long-term care costs would cripple the average middle-class American. So they are forced into that system, whether they think it's ethical or moral or not. They really have no choice, because there's no other option. Either that, or you pauperize the remaining spouse that's in the home, or you go through every piece of your assets, and rather quickly. Because in New York, we're talking about, the last number I think I heard was almost $150,000 a year average for nursing home costs in New York State. Who can pay that? Who's got a retirement plan that's going to be able to take care of that? So if I bring us back up to date to where we are right now, early pandemic decisions, and I don't want to reiterate everything Margaret said, so I feel really badly because it's in my script, so I've got to just highlight a little bit. Early pandemic decisions that really deprioritized nursing homes. There was months of limited testing that let the virus go unchecked. Even within this flawed system in place, lives could have been saved. Experts say that if just state and federal officials had acted quickly to make nursing homes a priority in those early days, we would have had a whole different set of outcomes. And the greatest era of it, most agree, was the failure to provide early and vast access to virus testing for residents and staff. That alone really put us on the road. So without testing, nursing home staff was focused on isolating residents who showed symptoms of the virus, even when we know that there was so many that had it asymptomatic, and who would have known without the testing. So they continued to spread the virus. Nursing homes were literally left chasing their tail, said one expert from Johns Hopkins Hospital. A lot of this goes back to the healthcare bureaucracies that we all know, that we've all bumped across, that our family, our loved ones, and we as professionals have bumped up against. Lack of inspections, unrestricted government cash that meant no accountability. And as Corona's really tore through these nursing homes around the country, so many families were standing there saying, so who's in charge here? Who do I go to? And it was just passing the blame, and there was no accountability. In late 2019, CMS and the states failed to prepare for a mass outbreak in America's nursing homes. And instead of making sure the facilities had adequate equipment and disaster plans, they basically did nothing. So they didn't have the masks, they didn't have the other equipment. We all know about that, right? I mean, Long Island was kind of the center of it, although I guess, it was originally out west, but we know that Long Island really became the center of, there's just one pandemic disaster after another. And then what happened? National policy, federal policy said critical hospitals and nursing homes, they were left to procure for themselves. They just threw up their hands, they stepped back, and they made it like the Wild West. They said, you'll have to go out there and procure the stuff on your own. So what did that do? It caused a bidding war between health systems, between different facilities. It's mind blowing when you think about that. And then finally, the federal, what should have been the vital support for nursing homes that would have contained, you know, the gear and the testing and everything else, which is what the vice president at the time, Vice President Pence, was promoting. In fact, a lot of the stuff they sent out contained unusable gear, expired or faulty surgical masks. There were gowns that were sent out with no armholes. And I know we all remember watching the news, watching nurses and others take plastic garbage bags and use that to protect themselves. It just still rattles me when I think back on that. And I know you quoted Elaine Ryan from AARP earlier. She actually termed this the Keystone Cops of public health response. I think that was really very true. And I'm laughing, but it's a sad laughter. CMS also made another huge mistake by suspending routine state inspections of nursing homes. Yep. And restricting long-term care ombudsman. I need to stop here because long-term care ombudsman, thank you, Heidi is shaking her head and she knows this stuff really well. The long-term care ombudsman is the most lack of oversight that we could possibly have had at a time of crisis. Many of you know long-term care ombudsman comes out of money from the federal government that goes into the states, and it's part of the Older Americans Act. And the vast majority, over 90%, at least in New York State, of long-term care ombudsmen are volunteers. And the vast majority of those volunteers are older people who then were told they could not go out, right? They had to isolate. And so they could not go into the nursing homes. They could not also go because they told long-term care ombudsman, you're not going in. So long-term care ombudsman were not going in. Family members were not going in. So who was there to advocate for the individual? We can talk about the isolation. We can talk about how it felt to be an older person totally isolated without any friends or relatives there to lean on, without most of the time understanding really any modern technology. And we know that many people that are in nursing homes, you know, even using a telephone has become challenging for them. And so can we even imagine a worse ageism scenario of how those people were treated and basically ignored? And part of it was because of staffing limits in the nursing homes, because so many staff got sick, they couldn't hire new people. It was just a perfect storm for all of this. I'm saying all this because the budget for long-term care ombudsman in New York State is negligible. Last year, we got an increase of $250,000. This year, the governor put in, again, a small amount. AARP has been asking for $20 million for long-term care ombudsman in New York. And if I could get everyone here who's from New York to take an action step, I'm going to get it. I thought I had the flyer with me and I was going to put it in the chat, but I will get a hold of it. But there is nothing that is more important than making sure that we have the right oversight for long-term care ombudsman. I know we have state legislators or their staff on this call, so I want to really hammer that, because there's nothing more important. And to not fund it is the height of ageism. It's saying that we devalue how people live at the end of their lives or for that longer period. And that is prioritization, folks. There is resources out there. New York State got a huge amount of money from the federal government, and we have a huge bonus extra money to spend to the tune of $200 billion. So you know what? I think we can find $20 million to do long-term care ombudsman the way it must be done with professionals. Not that we can't still have volunteers, but we have to be prepared to have people there on a regular basis. And right now, the way it's set up, I think it's only, I want to say there's one oversight long-term care ombudsman person for 6, which you can't get it done. You can't, for 6 facilities. It just can't be done. So that's the first line. If I tell you to get out there and be activists, I also want to just mention, sorry, I'm skipping around here because thankfully Margaret had a lot of my notes, so I don't want to reiterate. But I do want to say that I know I talked about Medicaid before. We really need to be looking at how that's being paid out, because that's part of the inequality. There's a lot of, when we think about nursing homes, when we think about long-term care, when we think about ageism, we have to think about racism also, because the overlap between ageism and racism is very clear, and there's huge amounts of data that back that up. So really, I need to start calling it the doubleism. I think we all have to start calling it the doubleism. National studies show that a persistent trend of highly segregated nursing facilities and that serve a high proportion of minority patients often have more deficiencies, lower levels of direct care staffing, and lower ratios of registered nursing staffing. So with fewer Medicare and private paid patients, these facilities are more likely to face financial constraints that lead to quality of care disparities. And so I'm going to make it real here for New York. Nursing homes with at least a quarter of African American, Black, or Hispanic residents were disproportionately impacted by the pandemic. These facilities have been twice as likely to be hit by COVID-19 than those with less than 5% of AAB and Hispanic residents. That's the most glaring data that just points it out. Now, Governor Hochul added last year through legislation that there was new requirements for New York State nursing home staffing, and also for how the money needed to be spent. 70% of the money needed to be spent in direct care. But how that direct care was defined is very interesting, and how that staffing level actually compares to what CMS recommends for the correct staffing level are two different things. And so that is something that we also need to look at. And also, unfortunately, Governor Cuomo decided to put off putting it into effect because of the Omicron and the pressures that were on nursing homes because of Omicron. We don't agree with that. And we feel like those changes around spending and staffing ratios are more essential now than ever before. So I'm going to stop there. I could go on, and I know you all feel as passionately as I do about this.
Beth, thank you so much. You know, I hear the fury from the two of you, and you know, we are going to go over time, over the 1 hour, because Lori Porter has an enormous amount of important stuff for all of us to listen to. One of the other things that I wanted before Lori starts, I wanted to also alert everybody on this call that our next Transformation Tuesday is exactly on the point that you were talking about, Beth, which is about financing of nursing homes in New York State and the legislation which requires the 70% to go to direct care. And we are putting together an advocacy campaign to make sure that it's in the budget, make sure that Governor Hochul does what she's supposed to do, and also to kind of limit the power of the industry that has sued to stop that. It's very esoteric, but very important, meaning that people need to be served.
Just real quick, in the chat, David McNally put in the phone numbers to call your legislators to make sure that the 20 million goes in for LitCop. So I hope that you guys will get that. And for those of you who cut and paste it and put it into emails and send to all your New York contacts so we can get our voices heard on this. We really appreciate it.
Yes, and Lori, you have as much time as you need because we need to hear your voice. You got it. I mean, Lori, please start.
Thank you, Jack. I appreciate it very much and honored to be here today. I have 40 years experience in skilled nursing homes, and I don't know why I didn't have it in my bio, but I wrote a book a number of years ago called Everything I Learned in Life, I Learned in Long-Term Care. And today I'm telling you that I can't stand to sit on more meetings where we discuss what happened. I want to be a part of something that discusses what are we going to do. And that is not repeating the same mistakes of a failed system for the last 40 years that I have been a part of. Yes, we all make a living from this business in some form or fashion, but it's time to not call legislators. We've been calling till our tongues have fallen out for decades to not have any change for nursing home residents in this country. I have over 2,000 of the most severe neglect stories that came long before a pandemic. The pandemic, I believe Margaret said early on, it ripped the band. I mean, it showed, it exposed what was happening for decades, that no one has cared enough. And those of us on this call right now, we're not doing a whole lot to help nursing home residents today. We have thousands of nursing home residents with maggots in their pressure ulcers today. We have to take action today. CNA shortage 250,000. It's because everyone wants to say, oh, we care about CNAs. They're the backbone. People, they're the heart and soul. And we've done nothing to help CNAs. We think the employer should do all this. Two things can be true at the same time. CMS totally underfunds long-term care. And the second thing that's true is nursing homes could have done better all these years. But when we continue to lift up a system called 5-star, and you are a profiteer nursing home owner, and you can be a 5-star facility with a 2-star staff, you're saying people don't matter to these elders. Yes. And there is no incentive if you are a profiteer to invest in your staff. We are here because nursing homes have been allowed to run amok of their own devices for decades and unable to provide that's in the regulations, person-centered care. There are a handful of facilities across this nation that probably do that well. Even through the pandemic, they probably fared better than the average facility. But one bad facility makes a nation of bad facilities, and we can't afford, as United States citizens, to sit by. Nursing homes have never been popular. We've never, as a country, made them popular. It's a fate worse than death. 9 out of 10 people will prepare for their death, but only 1 out of 10 will prepare for a stay in long-term care. And every one of us on this meeting right now, no matter how rich you may or may not be, if you live long enough, you will live in a nursing home, and your free will is gone. Who is their advocates but my members who are CNAs at the bedside who have been stifled for years? Don't talk to the families. Don't talk to the ombudsman. Don't talk to the state. We live in fear as CNAs. We cannot speak and use our voices except for in back alleys and sending it information underground to their association to be, what can we do? What can we do? We cannot repeat the same. And so I could go on, and I want to get to my ask really quickly because I do want to have time for some questions if anyone dare ask, because it is time for anyone who doesn't know nursing homes to become aware of them. Here's my call to action. Learn everything you possibly can about skilled nursing homes. If you think you already know, you don't, or we wouldn't be having these problems. Immediately join an advocacy group. I'm part of Live Oak Project because we are renegades. We intend to make our voices heard. And I don't care if we have to get 1 million wheelchairs and 1 million walkers and even beds on trailers. We have got to show a demonstration. Dogs became supreme after Sarah McLachlan did In the Arms of the Angels. But we can't do that for our old people. This is not a new problem. Both my parents died as nursing home residents. My dad was called the son of a bitch 3 times that I heard from the staff. My mother died as a result of a fall 22 days in skilled nursing. There were 2 CNAs for 60 residents that night. In 2006, how did anybody's mother stand a chance? We have to make this a personal problem, a public problem, not a policy problem, because there has been every administration known to man throughout these 4 decades, and no one has taken on nursing home residents. The most extreme form of ageism. Even those 60 and older show ageism toward the old. There is a difference, and I beg you to learn everything you can. Here's a list: how they're paid. How much are they paid? Who decides the value of an elder? What they're reimbursed on average is about $200 a day. How much person-centered care can any nursing home provide on $200 a day? They could do better, but they can't do great without leveraging nursing home residents as if they are currency. Now, they have been paid fully for baths they have not given, for meals they have not served. There will be no change until both CMS, HHS is held accountable, and only the voters, only you and I can do this. And I am telling you, our elders deserve it. Why is have you ever thought about this? Why is Health and Human Services serving in 3 capacities in this little thing called skilled nursing? They're the payer, they're the regulator, and they are the enforcer. There's something wrong with that. That never happens. And with all due respect, I love ombudsmen. They've been CNA's friends, maybe their only friends, but there is no teeth in most ombudsmen. I've known ombudsmen that have been called off a case because the nursing home provider donated to the governor's cause or to the campaign. It is time now to do something different. Do something different. And so that's my call to action. Take these opportunities for the Gray Panthers, join us at the Live Oak Project. We're a bunch of crazy old bats that mean business, and we need some more crazies to join us, because we all know that it is the squeaky wheel that gets the oil, not the one who calls up nicely politically and has our voice heard. Our screams must be heard. So, I believe both things can be true. Underfunding and the nursing homes could do better. It's not one or the other. If you'd pay us more, we'd be better. That's not the case. But after all, we are only paying in this country for our old citizens minimum standard of care. And we have to decide, do we want to grow old in a medical model? Or do we want to, I don't care how big the nursing home is, how institutional it looks. A lot of my friends will say, that's crazy, Lori. We're for small houses. We're for small communities. It takes all kind in America. It takes all kind. I might not like a small community because Gladys, my best friend, might be on hall 4. But it doesn't matter where an elder lives. They should be respected and happy. And I would say that I believe most of us would say we'll have a pressure ulcer as long as we're happy. Clinical models for elders, the federal regulations call for over and over again. My long-term friends on here will know this. It calls for a nursing home to help each and every resident reach their highest practicable level of functioning. So it is a bit overregulated because that sounds great, but really what a nursing home is supposed to do is take a 90-year-old person, restore it to a 55-year-old body, and anything less than that is a deficiency. But make no mistake, few homes will ever be shut down. because the HHS has no place to put the million residents that are currently suffering today. So sorry to preach and yell and go on, but
Go ahead, Lori, preach and
I
yell.
can't take it anymore. I just simply can't take it anymore. So any questions, comments, somebody want to jump in and just say anything other than, I just feel kind of crazy now that I've just gone derailed.
Lori, we need to hear you. You can go on as, just because you are the fuel that we need. It shouldn't be business as usual. Nursing home residents, nobody cares.
Exactly.
Nobody cares.
I was worried for a minute because I thought Margaret was going to make me have to defend Donald because of the commission. But what I want to say about that, myself and 24 other people served on that commission, and the solutions are within that report. It was just buried. And the first 2 meetings of that commission, we would have had these problems solved, except for they came back on and changed our directive. Our mandate was changed to do only the things that are within CMS's purview. Our collective opinion was CMS's purview must change. That is the problem that straps us all, including the nursing homes, from even doing better. Of course, a big corporation's going to eke out a little profit, but if you and I owned one, those are the homes that are suffering. The independent owners were driven out of business in the late 80s, early 90s, and for Beverly Enterprises and all the big corporations out there to own. Well, you can make a fortune if you are buying generic paper towels, generic incontinence products, generic of everything. And I don't know if you all are aware, but Florida is looking at their legislature and the industry reducing CNA hours to 1.0 per patient day. The answer in this country for problems is to reduce standards. And that is not a solution to person-centered care, culture change, free will, self-directed care. None of that is conducive for those things.
Lori,
Yes, sir.
when you had when you were in the coronavirus task force, you said that the scope was more limited. Was there an initial draft with a broader scope?
Oh, yes. And our initial mandate was to be bold, think broadly, make it happen.
Do you have
Second meeting in, no more of that.
What?
Was there anything drafted as to what the things needed to happen, what components there were from the first meeting before it was more limited?
I would have to go back and look at the communications, but I think maybe they were careful to mention those on the actual meetings. MITRE was the third-party government overseer of the commission. And so my understanding was the chairman of MITRE was the one that's told us to be bold and be brave. And it was Dr. Fleischer at CMS that came on and said we could only do what was in CMS's purview.
Okay.
Because we were being too bold and too broad.
Well, it would be great for us to understand what bold meant. So if we can get some document or some piece of paper or some whatever.
Oh, I've got a binder this thick with it all. So be happy to, if anyone would love to see the final report that never got a chance to, I'd be happy to email it to Jack or Emily, and they can get it out to you guys.
What I'd like to also ask people on this call, what questions do you have for any of our panelists? Because if you're not stirred up by now, there's something wrong with you.
Jack?
Yes, Jill.
I just want to say, I put a comment and I'm not sure it's getting there, but I have a really good advocacy tool for this, in response to what Lori said, which is, why don't we develop a sitcom about a nursing home in which the residents group together and a protest the way the CNAs and the staff is being treated. And they go to management, and I don't know. But that's my real idea for making the situation public.
Let's put that into the hopper and see. I'd like to ask Francis, can you please make a contribution, because you've been Francis Zionadin.
Yes, thank you. And thank you to all the speakers. I just wondered whether we could turn the discussions around, and I put it in the chat, by addressing all these problems as a violation of the human rights of older persons. It is not just a question of policy or program or money or any of those, but it must be seen as a legal issue. It is a question of the protection of the rights of older persons. A lot of this is also happening at the global level. At the UN, there are efforts being made at the moment to develop an international legal instrument to protect the rights of older persons, much like the Convention to Eliminate Discrimination Against Women, and much like the Convention on the Rights of Persons with Disabilities or the Rights of the Child, in order to provide some international standards. I think a legal instrument calling for the protection of the rights of older persons would make governments much more accountable, because we would have the opportunity to sue our governments for not protecting our rights. I think that is crucial. So I just wondered whether consideration is being given to that aspect. Thank you.
Before we answer that or address that, I want to know, please put in the chat, each of you who are interested in working on this effort in terms of whether it's the human rights of nursing home residents, nursing home transformation, organizing, whatever it may be. So, and I also wanted to ask other people, what questions or comments did you want to share with us?
Rains has his hand up.
I didn't see. So Rains, please.
Hi, this is actually Betsy of Rains and Betsy here in Berkeley, East Bay Gray Panthers. And yeah, thank you. I'm really glad I finally got to join Transformation Tuesdays.
Yeah.
So my question, to go right to the heart of it, was particularly to Lori. I have been trying to learn as much as I can about this issue as convener of our chapter. And we are part of the national, there's a gray paper that we wrote expressing all the outrage and the findings. And I'm not quite happy with the solution or strategy section. So what we're observing is the system's rotten. It's the only one we have right now, so we can't just shut it all down. I was taken by your saying we have to get the role of payer, regulator, and enforcer separated out. And
Absolutely.
Our state of California Department of Public Health, there was some major reforms 20 years ago, and nothing's changed because that department can't do that, can't seem to do it. And I'm glad to get a little balance on ombudsman, but I wonder if you could speak a little more. How could we create oversight that is not tucked away in a bureaucracy somewhere, number one? Can county grand juries be brought into play? Where should that accountability arm
The one thing that I would suggest is the fact that it's too easy for people to get trapped up in the bureaucracy of it all. So in my opinion, it is something the residents aren't capable of protesting on their own. and they're not capable of taking action. But a family member can have anyone go in and inspect a nursing home and give their loved one a head to toe observation. So we could create an inspection service that was privatized if we wanted to. Families just don't know how to be the squeaky
Right.
wheel. So for
What about-
example, oh, go ahead, I'm sorry.
Well, I just wanted to flag then the HR 3733 Essential Caregivers Act, which says you can't just shut down all visits. Since that seemed,
Right.
we've endorsed it. Grey Panthers National has endorsed it. Do you think that's an effective place right now to put to start right now?
In the
There's many other
visitation,
reforms.
in the
Pardon? Yeah,
visitation, is that what you're saying, Beth?
yeah, because
I don't, at this state of the game, there's,
there's so many things to improve.
thank goodness the residents had some CNAs because the families couldn't be there. But I mean, we just hear over and over from our members, they saw more people die from loneliness than they did from COVID. So I believe that, it's isolating enough to be a resident and be in fear of not being able to, be self-directed in any way. And
Yeah.
but now the biggest issue we're facing in terms of staffing is we're losing our institutional CNAs, those with decades of experience that got us through COVID. They're tapping out, they're done. They're either going into hospital but nursing homes is too broken. And truly, nurse aides just feel like they're the keepers of the worst secrets happening in America today of these atrocities. And they've been
It's a labor issue too.
Yes, they've been convinced that if they tell their stories, then it looks poorly on them, right? If they tell stories of neglect.
Got it. So therefore, we have a couple of people that are going to be working with us because I hear it. And I don't think ultimately, I'm hoping that you don't have a choice, that all you're going to be working with us to make stuff happen. There's a lot of stuff going on behind the scenes, but it's not publicly, people don't hear about. I mean, the public doesn't hear about it. And we have to change that as well. Who else has a question, a concern, I'm pissed off and I want to do something? Who else? Oh, there's got to be.
I guess I shut down the show, man.
Oh, no, you didn't. You opened up the show.
I'll just say something about just a short comment in answer to the people who want to see law and ethics become a bigger part of the conversation. I want to say absolutely yes to those people. But the United Nations has been trying to get a document on the rights of older adults for a long time without success. Now, I don't know what the obstacles are, but you can imagine that they are the capitalist neoliberal obstacles writ large. And if most of the UN managed to pass a document that supported the human rights of older adults, I'm not sure the United States would sign it. I mean,
they probably wouldn't, but nonetheless, even if that's true, which is likely to be true, the mere fact that the document is there is powerful. You say, no, you can't violate this. It's the protection of the human rights of older people, whether or not the US signs it. It's the power of the Constitution is there. Even if you don't know what the Constitution is, it's there. So it's that same kind of power.
You can't get the CMS to respect it. I mean, I totally agree. I think we should use the human rights language, and we should use it in the United States even before it actually is part of any document aside from the Declaration of Independence. I would like to shame Congress and the CMS. And one other thing about the law, why don't we have more suits? Why don't we have county grand juries? Why don't we have state district attorneys who are suing CMS for starters. I mean, I think the Justice in Aging is one of my favorite organizations. They had a dissenter on that quality committee that Lori was on. They wrote a dissent. Maybe Lori was part of that dissent.
I didn't give a full endorsement.
Well,
After it was revised, and many of us, I think there were 11 or 13 of the 25 that failed to fully endorse the full report.
right. Well, I'm very interested to hear what you had to say about the history of that report, Lori. I just didn't know that. And
yeah, it just simply was, we knew within a few weeks that it was going to be a non-starter and was done in name only, just to say he had done something to address the nursing home.
Mm-hmm.
I'm just trying to, I wanted to encourage other people to speak. We have a lot of great stuff here.
Evie has her hand up, and then Deborah.
Let Evie go, please. I didn't see.
So if we don't get out on the streets and start to make noise, just like the truckers did in Canada, and in Canada, they've just dropped the mandates for coming into the country. We've got to get out on the streets, and that's why the Live Oak Project began before we convened a group of people who are willing to make noise. The only way is to get people out on the streets, then people are going to hear us. We need to reach the masses. I don't believe the way the corrupt government policies and the oligarchs are running things, that we are going to make any difference unless we all en masse make noise. And we need to raise the awareness of every single human being that at some point, if they live long enough, they're going to need long-term care. And the way it is horrific and unconditionally unacceptable. We need to gather together and make noise. And that's my point here.
Fabulous. Deborah?
Thank you, Jack, and thanks to all the terrific speakers today. One comment I had wanted to make in terms of legal rights, and I always like promoting a wonderful statute that we have in New York, and it's under the Public Health Law, Section 2801D. And in my practice, and we basically handle elder neglect and abuse cases, it's a terrific statute that was created by our legislators because of the amount of nursing home neglect and abuse that was apparent in our state decades ago. And it's for the very purpose of a deprivation of a resident's rights. And so it's a powerful statute. It actually shifts the burden if a resident is harmed in a nursing home, for the nursing home to demonstrate that they took all steps reasonably necessary to have prevented that particular incident for the resident. And so I just like sharing that we have that statute, and it's being used more in the last, I would say, 5 to 10 years than it had ever been since its inception. But it's still something that, I think should be utilized even more. A lot of families aren't even aware, I think, that perhaps the statute does exist in New York State. And also in terms of the nursing homes, being held accountable, I also like promoting that in New York State, the Medicaid fraud unit of the Attorney General's office. I really am very impressed with the investigations that they do, and where they feel they can, they bring actions in cases themselves in terms of neglect or abuse that is investigated and brought to their attention.
Fabulous. All of this is grist for the advocacy, and nobody on this call is off the hook. We're going to be reaching out to you and putting together a clearer advocacy campaign with that kind of make noise, that action on this, hopefully on the streets in some fashion, working in partnership with all these amazing people who are on this call now, whether it's behind the scenes or in front of in the front. I don't know what else we have. There's so much richness here. But I want to say thank you to all of the panelists, because passionate and powerful examples of ageism in nursing homes. And it's what we've learned It is true. Nobody really cares except for a very small number of people. Let's make noise. And I want to say thank you to everybody for coming on today.
Hey, Jack, can I just do a shout out to James O'Neill? I don't know if everybody on this call knows, but he's now the new AARP New York State President, and I know many of you know him. So if you're looking to get in touch with AARP and on your activism, I'm here for you, but I know that James, as you all know, is very well experienced in all this advocacy work.
Yes,
So,
absolutely.
reach out to him, please, too.
Yes. Okay. Ladies and gentlemen, thank you for an energizing session.
Thank you. Thank you. I so appreciated it.
And everything, we're going to save the chats as well. There's a lot of good information there as well. Thank you. Bye-bye.